Hello, Memorial family, and I'm so pleased to share with you that the number of COVID positive patients in our hospitals is less than 100. And if you look at our critical care areas, they're less than 25. This is a huge decline in comparison to where we were in August, when our high was 744 COVID positive patients. We want to thank all the employees who got vaccinated. We exceeded 85%, or more than 12,000 employees were vaccinated. We're convinced that vaccination and adhering to CDC guidelines is contributing to the decline in the number of COVID positive patients in our community. Here in Broward County, we have reached the color of yellow as medium risk. This gives us a lot more latitude as to what we can and cannot do. But we urge everyone to still honor social distancing and wearing the mask in all public places. As the numbers continue to decline, we can now concentrate on our different projects and strategic initiatives that we had set forth back a year and a half ago. Most recently, we hosted an MCVI retreat to go over what are some of our initiatives when it comes to cardiology. We also broke ground in the Memorial Hospital West Campus for the new Memorial Cancer Institute building. As a result of the declining number of COVID patients, it has allowed me to do what I love most, and that is to round around the hospitals. I could tell that the staff were relieved about the numbers coming down. It's been a long, long journey, and hopefully this will be the beginning of the end. And let's hear more about what's going on in the healthcare system from Dr. Mark Knapp, our Chief Medical Officer.
Hello, it's good to be with you again. I'm really thrilled to talk about the progress that we've made as an organization, as a community, even as a society in dealing with the COVID-19 pandemic. We're seeing only 84 patients in our hospital at this point, and to remind you, we had over 740 patients across the system when we had our peak this past summer. Those numbers are not an accident. They're a byproduct of vigilance on the part of our healthcare workers and our community in terms of the things that they can do to keep themselves safe. Wearing masks, getting vaccinated, hand hygiene, social distancing, all have helped to decrease the numbers of infected individuals. The numbers of people vaccinated in Broward County has certainly increased. About 75% of the population have gotten at least one dose of one of the vaccines, and that has made a distinct difference in the ability for this virus to spread. I'm happy to also tell you that as a result of the decreasing numbers in the community and the decreasing numbers in the hospital, we are liberalizing our visitation policies. That means that every patient in the hospital can have at least one visitor, and it does not matter whether or not they are vaccinated. This is because we are now what we call moderate risk, or yellow. Ideally, if the numbers continue to fall, we'll actually transition to what's called low risk, and what we color code as green. However, we do have to remain vigilant that if there is a surge of any new strain anywhere in the world, that strain could spread elsewhere and could cause another surge even in our own backyard. So it's important for us to adhere to the basic tenets of good infection control practices. And that means social distancing, wearing a mask, hand hygiene, and most importantly, vaccination. Speaking of vaccines, it's now clear that Moderna and Pfizer both are warranted to get a booster, and they're now widely available both within the health system for our staff and usually in local pharmacies, etc. If you're eligible to get the booster, you should just go ahead and get it. We are not seeing side effects from it, and it does absolutely appear to be protective for those people who have waning immunity over time. Children have now been approved to get the vaccine. Those who are between the ages of 5 and 12, if they can get the vaccine, it makes sense to do it. It's been tested, it's safe. As I finish my comments today, I want to talk about something that really I haven't had much of an opportunity to discuss in the past, and that's patient safety and quality of healthcare. Over the next few months, I'm going to be talking about that more and more, and what it would really mean for each of us in our roles as care providers in this amazing health system. So with that, I just want to wish you all well. We're coming into the holiday season, and this is a wonderful time to be optimistic. Thanks.
Throughout this pandemic, the healthcare system has still maintained a very strong financial position. As a result, the Board of Commissioners approved to raise the minimum wage from $13 to $15 per hour. This will have an impact on 2,900 employees of the Memorial Healthcare System. We just feel it's the right thing to do. As everyone knows by now, I'll be retiring in April of 2022, and it has been a real privilege to lead this organization for the past 6 years. The Board of Commissioners have retained the services of a search firm, Wheat Kiefer. This will give us 6 months to find a replacement who can take this organization into the future with all the changes that we have experienced over the last couple of years. In closing, I'd like to thank all of you for your dedication and hard work during the past 19 months, and let's hope that this pandemic is coming to an end.